Do you know what insulin resistance is and how it affects your body? Let's take a moment to explore this. Insulin resistance is a condition where the body's cells become less responsive to the hormone insulin. Now, insulin plays a vital role in our body, acting like a key, unlocking our cells to allow glucose, or sugar, to enter and be used for energy. But when insulin resistance occurs, the locks on our cells become rusty, making it difficult for insulin to do its job. As a result, sugar builds up in the bloodstream instead of being absorbed by the cells. This can eventually lead to higher levels of blood sugar and potentially type 2 diabetes. It's a complex process, but one that's vital to understand as it affects a wide range of people, from the young to the old, the active to the sedentary. Understanding insulin resistance is key to managing our health effectively. So, what causes insulin resistance in our bodies? Well, let's dive right into it. Insulin resistance is a condition where the body's cells fail to respond normally to the hormone insulin. But what leads to this failure? First off, a poor diet is a major culprit. Consuming foods high in sugar and unhealthy fats can make your cells resistant to the effects of insulin. Imagine your body as a car and insulin as the key. If you keep using the wrong type of fuel, eventually the key won't turn the ignition. Next up, lack of physical activity. Regular exercise helps our bodies use insulin more effectively. But when we skip the gym or choose the couch over a brisk walk, we're essentially telling our bodies that we don't need insulin to function properly. Over time, this can lead to insulin resistance. Obesity is another key factor. Excess weight, especially around the waist, is closely linked to insulin resistance. The more fatty tissue you have, the more resistant your cells become to insulin. It's like adding extra locks to a door. The more locks there are, the harder it is for the key to work. Genetic factors also play a part. If your family has a history of insulin resistance, you might be more susceptible. It's like inheriting a car with a tricky ignition. You didn't cause the problem, but you're the one who has to deal with it. And let's not forget about chronic stress. Constantly being in fight or flight mode can wreak havoc on your insulin levels. It's like revving your car's engine non-stop. Eventually, something's going to give. Lastly, certain health conditions like polycystic ovary syndrome and sleep apnea can also contribute to insulin resistance. It's clear that lifestyle factors play a major role in the development of insulin resistance. But remember, it's not just about lifestyle. Genetics and other health conditions can also tip the scales. In the next scene, we'll dive into the effects of insulin resistance. Stay tuned. Now that we know what causes insulin resistance, what are its effects on the body? Let's dive in. Insulin resistance is a bit like having a key that no longer fits the lock. Insulin, the key, can't unlock the body's cells to let in glucose, the body's main source of energy. This causes glucose to build up in the blood, leading to high blood sugar levels. One of the most well-known effects of insulin resistance is the development of type 2 diabetes. When your body can't effectively use insulin, your pancreas works overtime to produce more, in a desperate attempt to keep blood sugar levels in check. Over time, this can exhaust the pancreas, leading to the onset of type 2 diabetes. But the effects of insulin resistance aren't limited to diabetes. It's also a major player in heart disease. When glucose can't enter the cells, it circulates in the blood, causing damage to blood vessels. This can lead to the formation of fatty deposits or plaques, which can cause heart attacks or strokes if they block blood flow to the heart or brain. Insulin resistance can also lead to a condition called metabolic syndrome, a cluster of health issues including high blood pressure, abnormal cholesterol levels, and excess body fat around the waist. Metabolic syndrome increases the risk of heart disease, stroke, and type 2 diabetes. Moreover, insulin resistance has been linked with polycystic ovary syndrome, or PCOS, a common hormonal disorder in women of reproductive age. Women with PCOS often experience irregular menstrual cycles, excessive hair growth, and infertility. And let's not forget about non-alcoholic fatty liver disease, a condition in which excess fat builds up in the liver. This can lead to inflammation and scarring of the liver, and in severe cases, liver failure. In short, the effects of insulin resistance on the body are widespread, impacting various organs and systems. It's not just about high blood sugar. It's a domino effect that can lead to a myriad of health issues. Insulin resistance can have serious effects on our health if left unmanaged. So stay tuned as we delve into how to manage insulin resistance in our next segment. How can we manage insulin resistance to prevent these health problems? Managing insulin resistance isn't a one-size-fits-all solution, but rather a dedicated journey to a healthier lifestyle. It's about making the right choices consistently. So, let's explore some of the most effective strategies. One of the key components of managing insulin resistance is a healthy diet. This doesn't mean you have to starve yourself or eat foods you don't enjoy. It's about balance. Consuming a mix of lean proteins, healthy fats, and complex carbohydrates can help your body use insulin more effectively. Try to incorporate whole grains, fresh fruits and vegetables, and lean proteins into your meals. Avoid processed foods and sugars that can spike your blood sugar levels. In addition to a balanced diet, regular physical activity is another cornerstone of managing insulin resistance. Regular exercise helps your body use insulin more efficiently. This doesn't mean you have to run marathons or lift heavy weights, unless you want to. Even moderate activities like walking, cycling, or swimming can have a significant impact. Aim for at least 30 minutes of activity 5 days a week. Next up is weight loss. If you're carrying extra pounds, losing even a small percentage of your body weight can improve insulin sensitivity. This doesn't have to be a drastic change. Small, consistent steps towards a healthier weight can make a big difference. Lastly, while lifestyle changes are often enough to manage insulin resistance, in some cases, medication may be necessary. These medications work in different ways to help your body use insulin more effectively. However, they're not a substitute for healthy habits. They are most effective when combined with the lifestyle modifications we've discussed. Remember, managing insulin resistance is a journey, not a destination. It's about making consistent, healthy choices that support your body's ability to use insulin effectively. With the right approach, insulin resistance can be effectively managed. Let's recap what we've learned about insulin resistance. Insulin resistance is a condition where the body's cells become resistant to the effects of insulin, a hormone that regulates blood sugar levels. This can be caused by various factors including poor diet, lack of exercise, stress, and certain genetic factors. The effects of insulin resistance are far-reaching and can lead to serious health issues like type 2 diabetes, heart disease, and obesity. It's not just a concern for those with a family history of diabetes. It can affect anyone, regardless of age or lifestyle. But there's hope. We can manage insulin resistance. Regular exercise, healthy eating, stress management, and in some cases medication can help control this condition. By making these lifestyle changes, we can reduce the risk and manage the impact of insulin resistance on our health. By understanding and managing insulin resistance, we can take control of our health and prevent serious complications. Thank you for watching.